should be provided education about the risk factors and appropriate management of foot ulcers, okay, and foot care, because it's very important that the family members know they provide a support system to the patients, but the patients and families should be provided general education about the risk factors and what to do, appropriate management of um, these issues. Treatment for patients that have issues, well-fitted walking shoes or athletic shoes. It can be custom made. Diabetic foot infections should be treated with antibiotics or hyperbaric oxygen therapy. Also, foot ulcers and wound care may require care by a podiatrist or an orthopedic or vascular surgeon or a rehabilitation specialist who is experienced in the management of diabetes. Next slide, please. So here we have another slide which shows the risk of A1Cs and microvascular complications. And this particular slide, this is a UK PD slide. This is the UK Prospective Diabetes Study. And the primary aim of this study was to determine the effect of intensive glycemic control on the incidence of complications. So as you can tell from the study, it showed that, just a 1% decrease in A1C in a patient's A1C decreased the microvascular complications. So back to what we're saying, glycemic control is always very important in managing a lot of these microvascular complications. The higher the A1Cs, the more the person has poor glycemic control, the more likely they are to have microvascular complications. So from this study, we can tell that just proper glucose control or proper glycemic control can help reduce the risk of microvascular complications. And that is it. We have references from where I did my study from. So, and this presentation will be made available to you if you need it, if you want it. So, Anne, I'm going to hand it over back to you. Thank you all for listening. I appreciate you taking the time. And again, I'm sorry for the technical difficulties we experienced. I know we're very pressed on time. So for the sake of time, I'm going to hand it over to our moderator, Dr. Limona.
And for that, thank you, Dr. Balimba. So we will begin the questions that we asked previously in the survey before Dr. Balimba started. Let's see. So please let me know if you cannot hear me, or if you can hear me, just give me a yes. The survey is in front of you. You have a couple of minutes to finish that, and let's see how if the if the presentation, if you retain something from the presentation. Have a few minutes. Now, while you're answering the questions, the previous questions, if you have any questions for the presenter, please put them in the chat section.
And can you hear me?
Yeah.
I just want to say that, also if people have any questions or they have any questions after this, they can also reach out to me, and I'll also provide my email information, my phone number too. They need to reach out to me if they're not able to have everything answered tonight, because I know that we don't have only 4 more minutes, so
Mm.
I'll try to answer as much as I can. But if I can't answer all, then you guys can always reach out to me via WhatsApp, phone, email, and I'll be more than happy to answer any questions. Thank you, guys.
Oh, great, great, great. So I'm gonna end the voting. Singer, as Dr. Balimba said, we're running out of time. I'm gonna end the voting right now. Let's see where we are. Dr. Balimba, do you want to briefly go over the responses to the questions?
Yes, I will briefly go over the responses to the questions. Yes, so, and thank you all for listening again. I'm sorry, this was my first presentation, so I was a little bit nervous, but I'm just going to go quickly over question one. Type 2 diabetics will most likely have an episode of diabetic ketoacidosis than type 1 diabetics. True or false? The answer is, sorry, the answer is false. And just a refresher from the first slide, I mentioned that type 1 diabetics are more likely to have diabetic ketoacidosis. Reason being, reason being that type 1 diabetics do not insulin production in the body. And so, as I mentioned, it's a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones, and this happens when your body cannot produce enough insulin. So one of the biggest problems that type 1 diabetics have is the production of insulin. They don't make, their bodies don't make enough insulin. So that's why a lot of them are on insulin therapy. Okay. Question two. Mr. John has a history of type 2 diabetes, hypercholesterolemia, and hypertension. How often should he be screened for diabetic kidney disease? As you all remember, because he has all these complications, these comorbid states, he needs to be screened annually, at least once a year. Okay? Because he's type 2. Remember, as a type 2 diabetic, they want to be screened at at onset. So every year, when they come in for visits, they want to be screened every year. Okay. The third question is, Mrs. Fields is a type 1 diabetic who has been recently diagnosed with retinopathy. She's currently on Lantus, Humalog, atorvastatin, lisinopril, and low-dose aspirin. She's concerned about retinal hemorrhage. Should she discontinue her current aspirin therapy? From the slides that I had below earlier, just because you have retinopathy, if they're using aspirin for cardio protection, aspirin is not a contraindication, and it does not increase the risk of retinal hemorrhage. So she did not have to discontinue her aspirin. She can continue her aspirin. Aspirin does not have any risks in retinal hemorrhage, so she could have continued her aspirin therapy. So the answer was false. And then the last question was that Ms. Doe is a type 1 diabetic who is currently on dialysis. How often should she have comprehensive foot evaluation to check for ulcers and amputations? Again, in the slide of the foot care risk of ulcers and amputations, this patient is on dialysis, so they're at a very high risk of ulcers and amputations. So it's important that she checks for this annually. It doesn't have to be done every 6 months. It doesn't have to be done every 2 years because that's too long. Normally, the recommendation is once a year annually. Okay? So again, thank you all for your participation. I hope you guys learned a lot about microvascular complications. I didn't see any questions from me. So again, if you think of anything later, please feel free to send me an email. I'm going to put my email below, and I'll also have my phone number, so that way you guys can reach out to me. Most of you guys know me on WhatsApp, so I'm on WhatsApp. But please feel free to reach out to me. If you want me to go over the slide again, I'll be more than happy to do that. Okay? Thank you guys again for taking the time to speak with me. Happy Sunday, happy week. And it was my pleasure doing this presentation with you guys.
All right, and now that it comes to getting a CE, this is Anne Limona, the moderator again. Now, when it comes to getting the CE, as mentioned in at the beginning of the presentation, we're getting this program accredited by the Nevada State Board of Nursing. Yes, I said nursing. It was last minute, so they provided a an ACP number, which I'll be putting down here in the chart section. If anyone also needs this certificate ASAP, I can send it to your email. I do have the participants' names and emails with me. I can send it to you ASAP. But we're also still in contact with the provider, the accreditor of the CE, to make it to make it easier in getting this streamlined onto our NABP website, which we are very familiar with. So if you have any questions, please send them to me at education@canfa-usa.org. That ACP number is N as in Nancy, V as in Victor, 010296 dash 1 dash 04 dash 02 slash 19. I'm gonna put it in the chart section. Just wanted to give it verbally for those that are trying to get off. And then I'll provide the email also. But as I said, it's accredited by the Nevada State Board of Nursing. We will be contacting you on an easier way on how to get the CE, but it has been accredited. It's just we're trying to figure out how to get it on our NABP website easier than calling NABP and saying, hey, I have this number. So thanks to our speaker, Dr. Balimba. That concludes today's presentation, but please wait, I'm still gonna put the information I said on the chat section. Just wanna finish up. And on behalf of Canfa USA, thank you for joining us today. We hope to see you at the next webinar on March 24th. That one is titled Medication Safety Empowering Pharmacists with Tools and Resources. Thanks for attending and enjoy the rest of your day. And I will be putting that. Thank you very much.
Good night, everybody. Thanks.